you know, it's nice to kind of bring people together so that you all get a chance to ask our partners and our team what's going on and the questions that you really want to hear the answers to. So we're really happy today to be joined by Mae Ardón, who is our fantastic programs assistant in Guatemala. So Mae, in fact, used to work for one of GoPhil's partners, Centro Maya, and now in her role as our program assistant, she works very closely with all 6 of our partners in Guatemala, supporting them, and she's in touch with them on a very regular basis. Over to Mae to give you a general update of what's going on in Guatemala. We also are hugely pleased to be joined today by Julio Letona Chávez, who is the Director of Prevention Programs, Community Education and Development at GoPhil's partner, Assade. Assade, some of you may already know, run a rural health clinic. So they are really on the front lines of the response effort around COVID-19. So I think, you know, we're all very excited to be hearing directly from Julio what's going on in his community and how we can kind of support him and his team. Most of you are already very familiar to GoPhil, but to those of you who we're meeting for the first time today, I wanted to just give a very brief introduction to who we are. Go Philanthropic Foundation started almost 10 years ago, and we partner with grassroots organizations across 7 countries working on health, education, and human rights issues. Community-based philanthropy is very important to us as a concept, and our philosophy has always been built around local solutions to local problems. So guided by the understanding that communities know best how to tackle the challenges that they're facing in the communities and how to respond to them. And we merely support what they're already doing on the ground. I mean, this has never been more relevant or more important than right now in the time of this crisis. And COVID-19 is having different impacts in different countries and even within countries on different communities. So our partners who are not normally, most of them are not normally engaged in emergency response and disaster response work. They've all had to turn overnight into emergency responders. So they are often providing the first line of response to the communities that they work with. They're providing support that they wouldn't normally be providing to their communities. So things like food aid, getting food parcels out to families, cash to the most vulnerable families where people have already lost incomes. And this is, you know, they're very often daily wage laborers. So if people aren't paid, they're not able to eat that day. And a lot of kind of health and hygiene products that communities need during this crisis. This is a huge, huge challenge for them. They're all very small organizations. They do incredible work and make a huge impact on very small budgets. And they definitely don't have the kind of cash reserves for this kind of crisis response. So this is where GoPhil's priority is right now. We want to step up and support our partners through this incredibly difficult time that they're facing, so that they can support their communities as best they see fit. So in response, about 2 weeks ago, we set up a rapid response fund to raise funds that we can send across quickly to help our partners to respond to these life-saving needs in their communities. So I'll tell you a little bit more at the end about this response fund and how you can help if you wish to, or how you can kind of share what we're doing amongst your communities. But right now I wanted to hand you over to Mae, because I think, you know, we're all here because we want to get a better understanding of what's going on in the situation in Guatemala. So Mae is going to update you on the current situation there and how our partners are responding to it. So Mae, over to you.
Thank you, Emily. Hi, everybody. I'm talking to you from Panajachel in beautiful Lake Atitlan here in Guatemala. I just wanted to thank you very much for being here, present. This is a great reminder of the importance of human connection, and it was really motivating to know that you're interested to learn more about what's happening here. I know that all over the world, people are going through a lot right now, so it means very much to us that you want to hear us out and learn more about how the programs are doing and what's happening here in Guatemala. I just hope that all of you and your families are safe and healthy. I would like to start with some numbers related specifically to the virus. So far, we have 95 confirmed cases. Over 12,000 people are currently in quarantine for having been outside of the country or having been in contact with someone suspected to have the virus. So far, we've had 3 deaths recorded and 17 people have recovered. These are numbers coming from our government. However, it's important to note that at the beginning of the crisis and after the first cases were reported, the government was only testing 10 people per day. So of course, the numbers are going to be low. Recently, they have been testing more people and have also sent some testing kits to other parts of Guatemala. At the beginning, it was only in the city and it was very limited. So the reason why they started testing more and sending more kits to other parts of Guatemala was actually for after the pressure from some people, some congressmen and some political activists in Guatemala. Most of the cases have been reported in Guatemala City. Most of them are people that have traveled abroad or have been in touch with someone, but also several cases are coming from returned citizens that have been deported from the United States. The government actually tried to stop the planes with returned citizens to come throughout the crisis, or at least that they were tested before arriving to Guatemala, but this hasn't happened yet. So we've had some cases coming from that as well. It's also a lot of concern in several communities as they have had several cases of atypical pneumonia reported, and also some deaths coming from pneumonia that are not being, that are people that have not been able to be tested. So we are, there's a bit of uncertainty going on in the communities regarding how, regarding these numbers that I'm sharing with you. Also this week, we had the first reported cases, the community cases, meaning that these are people that reported not having left the country in the past 3 weeks or having been in touch with someone that had. So of course, they are investigating the source of these new cases, and the whole community, which is Patsun in Chimaltenango, which is the region where Assade works. The whole town is in lockdown right now in order to prevent the spread. So going back to the numbers are relatively low, and many people have been attributing this to the quick response from our government. In fact, our president has been congratulated on his performance and the decision that he has been making internationally. And of course, there's a lot of people that do not agree with what he's doing. I want to share with you both of the perceptions. So first, let me tell you about our president. His name is Alejandro Yamatei. He is a doctor, and our vice president, Guillermo Castillo, is a lawyer. So of course, with their knowledge combined, they have been able to respond to this crisis somewhat efficiently. Of course, they have the knowledge and instruments to react. They have also been having a great reception from our communities here in Guatemala, especially people in Guatemala City. The government has been doing a great effort in sharing information with the population, investing in videos, like very well done videos, and doing broadcastings almost every day, so people feel very good about it. And I would say I'm sharing this with you because it's very rare that in Guatemala so many people are feeling good and supported by our president. He has even won himself the new nickname of Lord, and I'm not kidding, like people are calling him that, which is very interesting. And I'm mentioning this because, of course, the portion of the population that is happy with his actions right now are the people that have all their basic needs covered and can afford to stay home, do have clean water to wash their hands, and can follow all the norms. However, the perception in the communities is that they're not necessarily focusing on the rural communities that are where the need is is necessary. Another interesting part of our current president's resume is that he was in charge of the prison system a few years ago, and that he's linked with the military. So of course, many of his actions are very strong, and he has been using force. For instance, right now we're in a curfew from 4 p.m. to 4 a.m. and over 7,000 people have been arrested for breaking the curfew. Many of the current dispositions are being what I'm trying to say is that they're not getting to people by explaining situations and trying to make them understand, but rather as with the use of force, which is, of course, with our recent history, with our very critical recent history, it is worrying as well. From March 15, a series of dispositions to prevent the spread of the virus and different preparations started. Starting with the closing of borders, only Guatemalan nationals and residents can come in. This was followed by several Central American countries as well, which has caused many problems for a lot of people. Guatemalans can only travel through Mexico right now, and according to the government, this is the biggest risk right now as people are coming through that border after having been in different countries with high risk. Also, lots of foreigners are right now in Guatemala, people that couldn't leave the lockdown, and people that chose to stay because the situation was not any better in their countries. This is also something that's playing an interesting part in, for instance, rural communities with tourists or expats that are here. The second biggest action that the government took was the construction of temporary hospitals. Just to give you an idea, of course, as you can imagine, like Guatemala was definitely underprepared to deal with this crisis. The Ministry of Health reported having only 400 beds and 56 ventilators at the beginning of the crisis. Of course, the government has started to fundraise since then. And I say fundraise like this because it's, again, a bit uncertain, as when he started communicating to the population about all the needs and all the action that he was going to take to strengthen our sanitary system. They started talking about donations from the private sector. So multinationals and big companies from Guatemala started donating beds and ventilators and medicine. However, we're still understaffed, and both the Congress and the president are increasing the budget by billions of dollars, saying that they're going to be directed to the crisis. However, a very small percentage of that money is actually going to go to the hospitals and the doctors. And there are some very worrying destinations for this money. For instance, the last dispositions that were approved by the Congress before they suspended their activities was $5 billion loan that will go to increase salaries in the government, to military expenses, to fund the Central American Parliament, which is, by the way, where all the ex-presidents, the former presidents, go to serve. It is unknown to serve in what sense, but that gives them a few more years of immunity. They're also wanting to direct some funds to start a new National Constitutional Assembly, which is the only organism that is allowed to modify the Constitution. So of course, these are very worrying destinations for this money. They also tried to pass a law that would exempt new businesses from 100 years of taxes, all types of taxes. And they also approved a fund of 400 million quetzales to support small and medium businesses. However, the catch was that the politically exposed people have unrestricted and unlimited access to those funds. This means that they approved a law and a fund of 400 million quetzales to support their own businesses. And the rest of businesses and people are not necessarily being supported. Thankfully, we're seeing some some good work from the WINAC Alliance in the Congress. This is a group of Congress people belonging to indigenous representation groups, both females and males, and the first openly gay congressman. They're doing a great job. They're letting the population know about what's going on. The Congress actually was not letting the press inside to report back, and was not allowing the reporters to record what was going on. But thanks to these Congress people, we were able to know, and some of these actions were stopped. Of course, it's good, but at the same time, it's a bit sad to think that it's 5 or 6 people out of 120. The Congress right now has suspended activities, not before approving an increase of $5 billion for the budget. Other dispositions from the government related to the pandemic is the suspensions of schools, private and public, in all levels, the curfew that I mentioned from 4 p.m. to 4 a.m., the suspension of public transportation, prohibition of gatherings, suspension of all non-essential activities, and physical distancing norms. Right now in Semana Santa, Easter week, the restrictions have been increased with a travel ban. We cannot travel to other regions or other towns outside of our department. And there's a dry law currently going on. Besides that, the local governments and local authorities have set up different dispositions for their own towns, including, for instance, limiting the access and completely banning access to outsiders. Some communities are even restricting the access of food trucks. Julio will let you know a bit more about that. So also starting next week, the use of face masks will be mandatory, and people that are not wearing face masks will be fined. So these are just some examples of how everything is being imposed with force. Of course, the detrimental effects of the pandemic are more related with the inequality and how unprepared we are to deal with this crisis. As Emily was mentioning at the beginning, of course, the people that depend on daily wages and have lost their entire livelihoods are going through, trying to overcome many obstacles. A lot of jobs have been reported to be lost. Also, many businesses have already closed. There's even a new disposition for suspension of contracts, labor contracts. So, of course, this is creating a lot more problems that are social and economic for a lot of the families. And as partners in Guatemala and in Southeast Asia keep saying, communities are more worried about not being able to feed their families and survive throughout this pandemic rather than actually being sick. Although that, of course, is another worry. So can you imagine then what's happening to rural families that have no access to public transportation or clean water, that have lost their livelihoods and are even being restricted to go to a market, that cannot go out of their communities or have to spend crazy amounts of quetzales that they already don't have to just go and buy some groceries. When they get there, the groceries, of course, the prices have spiked. There are many communities that are experiencing shortages, not because of hoarding, but because of the fuel increase as well, and the lack of access to deliveries. The government, what is the government doing? Right now, they are supporting 200,000 families. Out of 17 million people, 200,000 families are being supported with some groceries. Most of them are being taken to the city, to vulnerable families in the city. Not so much has been done to support small businesses or support families in any other way. So again, that takes us to then what are our people doing right now and how much community support we're seeing. Of course, the nonprofit sector is stepping up and trying to support the families, and all of our partners are doing this right now. all of our partners in Guatemala are working with indigenous and rural communities, with women, children, and people with disabilities. It is very inspiring and motivating to see how they're honoring the commitments that they have with their program participants. All of them have been affected, all of their operations have been affected by these restrictions and by the pandemic. I'm going to try to summarize a bit of what's going on with each of our partners, starting with the ones that focus on education. First, with Aula Mágica, what Aula Mágica focuses on is supporting young children with educational lessons, and also young adults with teacher training. These teachers work in their communities, supporting preschool children to learn through education, and they also have a nutrition program. For Aula Mágica, all the classes have been suspended, but they have honored their commitment to their students and to their teachers by spreading information and continuing with their nutrition program for the children, and honoring the stipends for the teachers. These, of course, are families that already live in vulnerable situations. Aula Mágica has not been able to travel to even monitor how some of their students and teachers are doing. However, they are thinking of ways that they can continue to support their work. With Comunidad La Esperanza, which is a middle school for at-risk youth in Chimaltenango, they have also suspended classes and are trying to work with their students remotely. However, they are finding a lot of challenges. For instance, students not having a computer or not having access to internet, and they are trying to work by phone. They also have students that live under extreme poverty or that are orphans. So Comunidad La Esperanza right now is trying to bring them first necessity supplies and groceries so that they can survive throughout this time. That leads me to Entre Mundos. Entre Mundos is an organization that encourages and supports community-based grassroots and organizations through training, skills development, small seed grants, and overall serves as a great network for organizations to collaborate and find each other. Despite them having their own challenges right now, after their sustainability efforts have been compromised by the lack of tourism, the lack of volunteers, and they're still thinking about how to support others, how to support other organizations and their communities that they serve. Right now, they have partnered with GoPhil and Sparks Foundation to support organizations that have lost their income or that are working with sanitary services to support families with emergency needs, whether it's groceries, hygiene supplies, or other first necessity goods. Then Maya Traditions is an organization based here in Lake Atitlan. They empower Maya women artists and offer economic development opportunities. These restrictions have prevented them from being able to receive production from the artisans, and this, of course, has affected their economy. Right now, they're trying to find ways so they can keep on working. Their scholarships and literacy program are also suspended since no one can travel. They're also looking for other ways to support the families in the same way, whether it is with food or hygiene products or other essential items. Then we have two other organizations that work with healthcare related services. Of course, they're experiencing the biggest challenge, although I know everybody's going through a lot right now. Of course, Centro Maya and Assade that are providing healthcare services are being faced with many challenges. Centro Maya empowers people with disabilities to become actors of change in their communities. They offer education, services, therapies, and they have a labor inclusion program. They also offer some healthcare services. The participants of Centro Maya are already very vulnerable, of course, having disabilities, living in rural communities, being indigenous, and living in extreme poverty. So, of course, from the beginning, from the first few days of the crisis, they were already at risk. the solution that Centro Maya has found to honor the commitment that they have to their participants is first working with the parents so that they can continue the therapies at home, so that the participants do not miss out on their therapies and can continue with their progress. The other thing that they're doing with the families that are at high risk right now, which are 67 families, is that they are bringing them some packages with food and hygiene products as well. These are communities that live in remote areas and do not have access to any of these goods, nor have the funds right now to purchase them. And last but not least, Assade, who are on the front line right now, they offer medical and dental care services to Maya communities in Chimaltenango and now in other departments as well. Over 12,000 people benefit from their services, their passion, and of course their innovation. I would love to hear more about Julio, and I'm really proud to have him here and present him to let us know more about, first, what they do as Assade, which is very impressive, and second, the innovative ways in which they are fighting right now against both the COVID-19 pandemic and the inequality that we've been struggling with for a while. So Julio.
Julio, can you, there we go, you are muted.
Good afternoon, everyone. I want to start, as Madeline said, first extending our gratitude for taking the time for giving us this opportunity, because right now in this moment, it is very enriching to have these spaces to connect with you all. So I want to thank you for that. So I would like to introduce myself again. My name is Julio Letona. I'm the project director of Assade. Assade is a non-profit and non-governmental organization funded about more than 18 years ago. It was created to provide adequate healthcare for indigenous communities through an inclusive and a participatory model, especially for those communities that doesn't have any kind of access to healthcare. The idea of how Assade arises lies in a big problem that we have in Guatemala, that we are talking about more than 50 years ago. We have a structural gap in healthcare coverage that goes more near to 40% at national level, that doesn't have any kind of coverage related to healthcare. And this matches especially with rural communities. And this is how Assade started trying to do something related in this area. And over the time, has learned a lot of things with these communities. And now Assade has settled a clinic with basic and specialized services for all these rural communities, not just in Chimaltenango, but also in another department. As Madeline said, in the regular activities, Assade covers around 800 persons per month, especially remote communities that doesn't have the services that we provide. And honestly, in this area, we are just one of the doors for having access to this kind of services. But the idea of Assade goes beyond just provide a healthcare services. So the idea of Assade was to try, like I mentioned at the beginning, to develop a participatory and inclusive model. So this means to reach and have approaches with the communities and have this understanding of the concept of the conception of the right to health for these communities, and take all these ideas, all these thoughts and feelings that they have and create a model, an adequate model that is able to provide adequate healthcare according to the most real needs of these communities on their values of respect, of humanism, and love. So this is a small summarizing about what Assade does. So I would like to continue sharing a little more about how Assade is trying to confront the current situation related with COVID-19. So to start talking about this, I would like to reinforce all the relevant aspects that Madeline already shared with you. So we need to imagine first that our national structure of healthcare, it is already, before COVID-19, our national structure of health, it is already collapsed, it is already inadequate, it is already incapable to cover all the real needs at national level. So if we imagine that, and then we add this situation, we are conceiving a real a scenario of a very deep crisis. So what happened with this? It is really interesting because happens from different aspects that we will want to mention today. So you can have an idea of how all this is affecting in this region. So, for example, as I mentioned before, in the region where we work, there is not a lot of infrastructure for healthcare services, and this is an historical thing. What happened today is that all the efforts to try to face COVID-19 that are being developed in Guatemala City. So what we get in these rural areas of all that pretty much summarized and information that most of the cases we are not like able to understand correctly the information. This means that the action of the government reduces in these areas just to radio communications about washing hands and about the correctly way to cough, for example, or to stay at home. So, but these kind of measures are very interesting because there are like the most basic and the most understandable measures facing this kind of virus. But what happened in these communities is that, for example, there are communities that they don't have any kind of access to water. So coming today and saying you need to wash your hands every 30 minutes so you don't get the virus, it is illogical because what we don't do before to try to solve a long list of other problems, now this is like putting more load to our structure of health. As this example, it happens the same with transportation, for example, that currently we don't have access to public transportation, but these communities already have that problem before. So, and this is one and not the only reason why Assade is still working, and it is like with a very strong feeling of continue working through this crisis, because we are here thanks to all these communities that we have created, because we always believe that this model that Assade promotes is created by communities. And this is the whole idea of the model, that now that we need to confront the COVID-19, it is like a time that Assade needs to be here and try to join effort with the community to trying to find solutions. So related of the currently restrictions that we have in region, one of that is that we are not allowed to pass from one department to another. So for that purpose, Assade needs to process permission to do that, a permission that we already have to pass through one department to another. The other thing is about the shortage of things. Here we are living a shortage of basic needs for home, for example, but we are also facing a shortage for medicine, for example. Assade currently is receiving more users than regular basis, and all this is related for the same situation, because at the same time that we are having the increase of cases of COVID-19 at this point, the rest of diseases continue happening, especially in these areas. So the whole point of this is to try to find a balance, to try to continue working and attending regular disease, but at the same time, making awareness, promoting prevention, and trying to develop our own frameworks to try to confront the COVID-19, because at the end, what happened with these communities in which Assade work is that we are by our own. We need to find out the ways to figure out how to confront it, because this is what happened for several years. So will not be exception. So this is why for us it's very important to be here and try to speak up, not for just for Assade, but these communities that are confronting this. So some of the things that I would like to mention also is, for example, that we have an increase of respiratory problems. That to give you a little more context, respiratory problems is the first cause of death in region. We have an increase of that cases during the last 4 weeks, for example. So what happened with this, that we are receiving more users that we are already able to cover. It is like putting in risk our model of self-sufficiency that we have developed during the last 15 years. That we have a percentage of people that receive treatment for free here, and another percentage of users that receive all the medical treatments in exchange of a donation. So our model was created under a base of a Mayan term called Ushubal. That means that all people put for a welfare, for a common welfare, and then this common welfare, when everyone's of the group needs, this common welfare is going to embrace them according to their needs. So, and this is joined with the idea of that the organization will stay here as long as community wants to be here, because at the end, the organization belongs to the community. But what happened with this situation is that with all restrictions, with all people, for example, not being able to move from one location to another, for example, to work, or having more limited hours to work, we need to remember that all these communities live under the line of poverty. So it is very difficult in this time, for example, to not understand the situation. So with that purpose, Assade during the last 4 weeks opened the percentage of persons that having access for free to the healthcare services. That means that currently we are receiving free person and we are not requesting a donation fee for the services because we understand the situation, and the whole purpose of the organization is that if there is something possible to do here to treat people under all the values and under all the model that we have created, Assade is willing to do it. So I don't know if we can have a moment for questions, or if I want to.
That would be great. Thank you so much, Julio. I think that was great. I think that gave us a good flavor of what's going on in your community and with your services. And Mae, that overview was fantastic. We've got oh, I don't know can other people see there's something going on with the screen? Okay. Yeah, maybe if people want to kind of send any questions across for Julio or Mae, that would be great. I'm sure people have some questions that they would like to ask. So please feel free to send those across. I had one question for Mae actually, which was about the point that you made about the face masks being mandatory from next week, Mae. I just wondered, are there enough face masks? Does everybody have a face mask? Are these being provided for free? Because I know in most countries, I mean, here in the UK, we have a massive shortage of face masks and protective equipment. So I wanted to ask about that new law that's coming in from next week.
So that's very interesting, Emily, and many people were talking about that. Of course, there are shortages for N95 face masks are completely unavailable anywhere. And of course, it's in similarly to other parts of the world where they are asking people to stick with the fabric ones and leave the N95 to the healthcare workers. People are still looking for them, and it's difficult. Of course, in rural areas, people do not have face masks. The government is going to provide 3 million face masks at the beginning of next week, apparently. Unfortunately, so far, these efforts seem to be concentrated in Guatemala City. So I am afraid that they are not going to be making it to the rural areas where we are. Right now, on the streets, people are selling face masks for 5Q, which is less than $1 US each. However, they obviously are not conforming with all the criteria and are basically, they're not useful. It's been a source of income for a lot of people, but they're not effective. So,
thank you. So Ron Renault has sent a question to you, Julio, at Assade. Like, what are you doing to protect your own health workers? Do you have the equipment that you need to keep your health workers safe during this crisis?
Okay, that's a very good question. There is some information related to that I would like to share. So, to be honest, we don't have the most adequate equipment to confront this. But the thing is that we have the basic equipment, and also we have the be willing and the passion for this. We do understand about the risk, but like I said before, the whole point of the organization is this. So we try to do all our efforts to cover all the risks related. So for example, talking about the mask, the face mask, there is a shortage of it. So we need to be very think about that very often. For example, how often we use our face mask and how many face masks we have in our warehouse, for example, because part of our prevention program, we include the delivery of face masks to communities, for example. So we just not just a face mask, we also for the staff of Assade, we include gloves and also this disinfectant or antiseptic house. In the entrance of Assade, we also have the antiseptic for the floor and also for the clothes that we wear. We just receive people if they are wearing masks, if they are disinfected in the entrance, and they take the temperature in the entrance also. And all the cases related with that, we try to be like very, to keep all the guidelines as long as we can, because we are concerned, for example, about the shortage of face masks, because this looks like it's going to, we are going to pass for several months like this. So at this point, the hygiene and the sterilization process here are one of our main priorities, because to keep Assade running, we realize that depends of that. Because, for example, the public health center that we have here shut down their doors for the same reason. They closed because it was a change, for example, that all the hospital is going to take care about all the patients that are here in these communities. But we need to think again about all the barriers that they need to pass through to get the access. So this is why for us, the hygiene measures, for example, or the prevention measures are very important. So each patient that comes through the clinic receive like a small training about prevention measures about COVID, no matter the purpose of the visit to the clinic.
And yeah, there's a couple of questions around your medical supplies. Like you've talked a little bit about the protective equipment, but how is it getting essential medical supplies at the moment? And is the government helping at all to get supplies such as food and water to medicine to the rural areas?
This point, we haven't seen any kind of actions related to the government, which is really sad. But like I said before, we believe that this situation will not be the exception, as we have living for a lot of decades here, that when happens something like this, the action, they are kind of like a firewall action. Just they try to do something when things are already happening and not trying to do something to prevent, for example. But at this point, we don't have seen any kind of action related to that. So the local government try to follow the guidelines that they receive from the central government, for example, that is like to close the border of the area and to do not allow people from this area going to another area. In the meantime, the struggle about that, it is like a real challenge, because like I say, there are shortages in medicine also. For us, it's very difficult now getting some kind of medicine, because in one side we have a shortage, and the people, the providers that already have the medicine, they have increased their prices with a non very good way. So
okay. And then we have a question from Hannah of Trauma Textiles. She wanted to know about, with the current departmental restrictions, how are you able to travel to the communities to deliver supplies? And I guess this also applies for our other partners who are trying to support communities. How are they managing to get to those communities without risking taking the virus as well, of course?
Okay, about that. So what we do first, we need to request a permission to do it. A permission that it wasn't easy to get. We have a lot of barriers to receive it. Having this permission, we are allowed to pass from one border to another of the departments. The way that we pass through is that there is a military review point in each border, and they will, you need to show the permission. They need to check all the interior of the vehicle where you are mobilizing, what kind of, if you are taking medicine or you are taking supplies, or anything you are taking, they review it all. You need to take the temperature also. And after that, they will spray with antiseptic all the, especially the wheels of the cars and all the car. And this is how you need to pass through one point to another. So this is a very interesting question because as our national structure of healthcare, it is not prepared for this kind of situation. There is like a lot of problems for all in Guatemala to try to first to follow up the guidelines to prevent, and the other thing is to establish the guidelines to be prepared for that. So, but in general, this is how we are mobilizing during this time.
Okay, we just had one final question. We're running out of time, so I'm afraid we're not going to be able to go through all the questions. But Lydia had a question around what kind of collaboration is going on between NGOs and clinics at this time? Is there much collaboration that's going on, or is that very difficult due to the restrictions? Mae, do you want to take that?
Yeah, that's a great question because, and it's actually something that we've been talking about with Julio and other partners. There's a lot of collaboration in regards to the spread of information. As Julio reminded us today, that is a big part of course, as to some of the problems, how the information is getting to the communities. A lot of the information is getting to them already mixed up or you know, not the complete picture and everything. So of course, relaying accurate information in ways that will be easier to understand, for instance, graphic ways, or using their the mother language is very important. So there's a lot of collaboration going on in that sense. For instance, Assade created a community manual that we're going to be sharing with Centro Maya and Entre Mundos and whichever other organization is interested in accessing it. It's very graphic and very descriptive with a lot of examples, which is kind of what we need right now in the Maya communities. Also, there's an organization in Shela that is working in creating informational videos, like with preventive measures in all 22 Maya languages. So these are being spread around. So I think that, of course, there are many other ways of collaboration. For instance, Maya traditions, and I'm talking about multicolores right now with, as my role with multicolores. For instance, we're thinking about asking them to fabricate the face masks for our artists in the community. So there's a lot of that type of collaboration going on. Many of these organizations that work with production and textiles are out of work right now or not being able to produce. So things like that are happening as well. Many are collaborating in terms of transportation to deliver the packages to the families as well. That type of thing. And yes, I would say with a lot of support and motivation as well. It's very, as you probably all have experienced, it's very motivating and inspiring to talk to other organizations that are going through the same things and thinking of different ideas. From my perspective, perception and in my opinion, there's a lot of collaboration going on and a lot of support, even if people are, we know that a lot of organizations have a lot less room to work with the restrictions, but everybody is trying to work together.
I think that's really good to hear. I mean, I think we all know that, yeah, collaboration is going to be so key with such a sort of widespread crisis like this. From the GoPhil side, we had a call last week with all our Southeast Asia partners at their request. So they had a chance to come together on a Zoom call like this and brainstorm their kind of the challenges that they're facing and any strategies they have. Mae and I have been talking about doing something similar with the Guatemala partners, looking at bringing them together so that they have some space to kind of talk about what's happening in their communities and seeing how they can support each other through this time, which, you know, we know that's so powerful, that kind of collaboration. We're almost out of time, and I know, you know, you all got a lot going on at the moment, but I just wanted to, you know, thank Julio, who is incredibly busy right now. We're thrilled that you were able to take an hour out of like such a busy time to come and join us, and for both of you to kind of share, you know, so honestly and openly like what's happening in Guatemala. And I also wanted to thank Travis for initiating. This was his idea to have these calls, and he's kind of put all the logistics and organizing in place in just a week's time. You know, this is, you know, for me, I mean, I felt so grateful to be part of the GoPhil community at this time, because, you know, with everyone kind of going through so much, you can see how everybody has come together. Many of you on this call have already reached out to us over the last few weeks, seeing how you can help, checking in on our partners, you know, wanting to know what's going on and how our partners have been affected. And, you know, that's just incredibly moving and incredibly motivating. And, you know, makes us feel really part of, you know, a very special global community here that are looking out for each other. So thank you very much for taking the time, all of you, to join today. I did promise you I was going to mention the Rapid Response Fund again before I go. It's an amazingly difficult time for everybody, but, you know, our partners do, you know, huge amounts with very little, so every little bit does make a difference. So if you would like to support the General Fund or any of our partners, you can go to our website and there's information about the Rapid Response Fund there. Please, you know, share it with friends, share it with your communities. You know, I hope you enjoyed hearing what was going on in Guatemala. We're going to do more of these webinars on different countries. So next week, we have an India webinar, which we'll be sending out the details for tomorrow. It's on the 17th, slightly earlier than this time, at 9 o'clock Mountain Time. So I hope some of you can join for that. We will have 2 of our fantastic India partners coming on to that to share the challenges that they're facing and how they're responding in their communities. For those of you whose questions we didn't have a chance to answer, we will try to get back to you on that. And please feel free to reach out to us at any time. So if you have more questions coming off this call, please feel free to send them across and we'll forward them to Mae and Julio. So yeah, I just wanted to end by saying, like, to stay safe, everybody. Take care of yourselves, your families, your friends, and you know, look after yourself. We're all going through a lot everywhere right now. And we need to kind of stick together and keep looking out for each other. So please feel free, reach out and stay in touch with us. And we look forward to seeing you all soon. So,